One.
Hi all. Welcome to the Board of Health meeting of April 13th, 2020. This is Judy Giorgio. I'm the health agent. Please note that this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 18, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Chatham Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the number on the screen. Despite our efforts, if we are not able to provide for real-time access, we will post a record of this meeting on the town's website as soon as possible. So I'd like to turn the meeting over to the Board of Health Chairman, John Beckley.
Thank you, Judy. The first thing I'd like to do is call roll of the Board of Health members to establish who's on this call. Ed Sheeran, are you on the call?
Yes.
Dr. Noble Hanson, are you on the call?
Yes.
Dr. Alan Ward?
Present.
Ron Broman? And I know Burton Siegel is not going to be on the call today, so the last person is myself, John Beckley. So we have 4 members of the board on the call, so we have our quorum. Let's get right to the agenda for today. We have 3 items, the first of which is a general update on COVID-19 from Dr. Robert Duncanson, the Director of Health and Natural Resources. Bob?
Good afternoon. Can everybody hear me okay?
Yep.
Yes.
Okay, so the latest information we have, and I'm just looking at what's coming out from the state right now. As of earlier this afternoon, there was approximately 1.9 million cases of COVID-19 worldwide, with roughly 118,000 deaths worldwide. In the US, we had about 573,000 cases with approximately 22,000 deaths. More specifically in Massachusetts, the numbers that have just come out are indicating 26,867 confirmed cases in Massachusetts, with a total of 844 deaths in Massachusetts.
How many was that, Bob?
844.
Thank you.
And for Barnstable County specifically, we had 502 confirmed cases. That's only up by 1 from yesterday, so I'm not sure that number is totally accurate, but that's what the state's reporting. And we had 1 additional death recorded for Barnstable County, bringing the total to 17. Specifically in Chatham, we have 4 active cases of COVID-19 in Chatham. We had 2 prior cases, both of which have now been released from isolation, and so we no longer consider those active cases, if you will. So we have
What was that number, Bob?
Which one?
Number? I heard the 4 active plus.
Plus, we had 2 prior cases that have completed their isolation period.
Okay, thanks.
This is Noble. Can I ask a question just real brief? So does that mean that Chatham has had a total of 6 cases?
We've had a total of 6 positive test results. There may be more cases But if somebody's not being tested, they wouldn't necessarily be
Oh,
in the
right.
system.
I mean, six positive cases by test.
By
By
test.
laboratory.
Okay.
Okay.
Right.
Yep.
And okay.
Yeah, it gets very tricky in terms of how it's described.
Well, we can talk about that later when we go into this policy thing. I think about what the nomenclature is.
Yep.
Okay.
There's been a couple of other updates since we last met, mainly coming out of the state government. They released their new guidance on rentals, as well as some other areas that we've posted up on the website to kind of keep people up to date on what's going on and what's been reported. So I would urge everyone to just keep an eye on the town's website. And it's now set up so you can sign up for a message whenever we update the website, or we put information up there, that we feel is important for the public to be aware of, so we can send out an email blast to people that have signed up for the website. So that makes it a little easier for folks. They don't necessarily have to just, log in 2 or 3 times a day to see what's up and new.
Good.
Probably the biggest change since we last met is it originally started with CDC, and then the governor and others have weighed in on this idea of everyone wearing some kind of face covering when they're out, especially in environments where folks can't maintain the recommended social distancing, which is at least 6 feet. So in grocery stores and pharmacies and places like that, everyone now, from CDC to the governor, Department of Public Health, we're all recommending that people wear some kind of face covering. It doesn't need to be an N95 mask. It can be just a regular mask. It can be a bandana. It can be whatever you want to make at home. We do have directions on the town's website from CDC showing you how to make your own mask at home out of a t-shirt or some other type of material. So that's kind of the big major change that's happened in the last Board of Health. And with that, I'll be happy to answer any questions. And if not, John, I'll turn it back to you.
Any questions for Dr. Bob?
This is Noble. I had a question on the rental guidance.
Yep.
So if you cannot make a summer reservation now, or you can't, if you have a summer reservation, you can't hold it. Or I guess that's a confusing.
Yeah, how does it apply to,
I mean,
suppose somebody's in a rental today and they've been there for 2 weeks. Do they have to vacate?
The way the guidance came out, when it came out, was somebody who was in a rental could stay until the end of that rental, but they could not extend it for any reason.
Okay.
So if you were
and no new rentals until further notice.
Unless they qualify.
Right, unless they qualify for the various essential services categories.
Right.
Yeah.
Correct. Yep.
Yeah, they were very specific that there's no rentals for vacations and things of that nature.
But healthcare workers. And then, has the state done anything with the Airbnb situation? Because it's difficult to get a handle on what's happening there.
They have not done anything specific that I'm aware of with regard to Airbnb and VRBOs. This guidance did apply to them, as well as just a person renting out part of their house. I've had mixed messages, if you will, from the public. Some folks have said they weren't able to make a reservation on Airbnb, and other people said, "Oh yeah, you can." So, but I'm not aware that the state, other than the guidance that they sent out, which went to those companies, We similarly sent it over to the Chamber of Commerce as well as other entities in town that we have information and email addresses for, so that, we've been trying to get the word out to people as best we can between the website, Channel 18, and direct emails.
All right,
This
good.
is Judy. Just so you know, the governor's guidance was for short-term rentals, which is defined of under 31 days. So anything longer than 31 days, people technically can reserve. So, and then I do know that Airbnb did send out a message to anybody who had rented in Massachusetts, letting them know about the guidance from the
All right,
governor.
You mean somebody who rents their property?
I believe both, the renter and the
right.
rentees.
Yeah.
Good.
I went on Airbnb, looked up Chatham, and this is a few days ago now. There were 18 rentals, I think, but they did put a flyer finally up on the top of the page which says check local regulations about rental availability. In a red sentence, so they're warning people, but it sounds like they're leaving it up to renter and rentee kind of. But there is a notification on the website to check local guidance.
Well, that's good.
But so somebody could rent July and August for the summer then, theoretically.
Theoretically, yes.
Yes.
Okay.
Interesting. All right, any other questions for Dr. Bob? If not, we'll go to item 2 on the agenda, which is policy ratification regarding the release of COVID-19 case counts to the public. Who wants to introduce this one, Bob or Judy?
Well, I can start it off. When this whole thing first kind of got cranking, the way the state's been sending out information is they've been breaking it down to county level. So the state was indicating, how many cases Barnstable County had, how many cases, the counties up towards Boston all had. And there was a lot of concern and a lot of discussion among the health agents and others, because, we were getting calls from members of the public in town saying, well, that's well and good. How many cases did Chatham have? How many cases does Barnstable have? How many, they wanted to know exactly what the situation was, where they live. So there was, a fair amount of discussion with the state kind of going back and forth. Originally, there was some reluctance on the state level to, tell us to go ahead and issue stuff at the municipal level. Ultimately, it changed, and they did come out with some guidance indicating that the state was going to continue to release information at the county level, and it was up to the towns to decide whether or not they wanted to release town-specific numbers, with the proviso that obviously no identifying information could be given out, such as name or address or anything like that. And, as you can well imagine, it's private medical information, so we have to be very careful what we give out to whom. I went right along with the original guidance from the state. Originally, we in the health side of things were privy to this information, weren't even able to advise first responders, namely police or fire, about cases in town. That subsequently was relaxed, and we are able to provide police and fire departments with the address only of known positive cases. So, that made it a lot easier for fire, because that way they'd have a heads up, if they were going into a residence and there was a potential situation. So what we've been doing in Chatham is we've been releasing, obviously, the county level information. It comes from the state. And in response to media inquiries, we've also been releasing Chatham specific numbers. So we're not telling people where in Chatham, we're just giving them an idea of how many cases we have in Chatham. in total. And that's probably what about 75, 80% of the towns. There are a couple of towns that are not releasing that information at all, and other towns have been doing it right along since day one. So that's kind of where we're at.
Okay, so the reason that we're discussing this at all is because at the end of the day is a policy decision by Chatham of how we wanted to manage our local data. And I wanted to at least afford the Board of Health a chance to have a discussion around this and hopefully ratify what we're doing so far, which is to be transparent in the number of confirmed cases, laboratory confirmed cases to date, if we get any media inquiries. So with that, I'd like to hear any discussion or comments from other Board of Health members on how you see this policy.
Yeah, this is Noble.
This is Alan. I see that to be a reasonable approach.
Okay.
What approach is that? This is Noble.
What was just presented by Bob.
Yeah, he was breaking up a little bit, so I'm
Right.
not sure I caught it all, but this is Noble. I mean, I think that the town should release the case count of virus cases when they get it, and make it public on the website or whatever. Most towns are doing that, and I think that people deserve to know and they want to know. And I don't know if we are or we aren't now. I know the numbers come out, here and there through different people, or, you get asked a direct question at the Board of Selectmen meeting by a resident, and you feel obligated to answer it, and so a case count comes out. But I think it's better for the town to be just fully transparent. I think the residents can handle the information they deserve to know, and just as soon as you get a new case in Chatham, to announce what the current case count is through the website or however you do it.
Right.
And that's what most towns are doing. So we're right in line. In fact, we're probably in the minority now. If we don't do that, it looks like we're not being transparent, or different people, say different things. So I think that. The second thing I think is the terms you use. I think it basically, and I mean, this is open to discussion, obviously, but I think you just give the case number. Like right now, we have 6 cases.
Correct.
When you get into prior and active, I think people don't know exactly what you're talking about. I mean, I hardly know what you're talking about. They mainly want to keep track of total cases. That's what, as Bob charts on his graphic, which is really helpful. You see the rise. You can see when the peak is, when you're coming down. That's total cases. I think that's the number that you put out there, and for public information, as a separate paragraph at some other time or response to a question, if you want to get into all the active and when they're released and all that, that's a whole discussion, but it gets confusing to people, I think. That's what I feel about it.
I think I would agree with Noble. I think our outward look should just be to update the ongoing cumulative number of laboratory confirmed cases of residents, and just stay with that. And then upon more detailed inquiry, we can then, further break those down if there's a need to do it. Ed, where do you stand on this?
Who?
Ed, are you okay with?
Yeah, I'm in favor of the last outline.
Okay, that Noble went through.
Yeah.
And then I just repeated. Okay.
This is Judy.
Go ahead,
Bob,
Judy.
is there some place where you do release the number routinely, Bob, or is it, as Noble said, just when people ask, or you're speaking before the Board of Selectmen, or how are we releasing the numbers?
Generally, they've been released in one of two ways, either during a presentation to the Board of Selectmen in response to a question, or, previously I was getting pretty much daily requests from the press, namely the Cape Cod Times. And so, in response to them, I've noticed in the last couple of days, if we don't have any change in our case number, the Times isn't even putting it in. They're really only reporting the towns where there's, additional cases have been recorded. So, originally they kind of had a breakdown of all 15 towns on the Cape, and they've kind of moved away from that in more of a general, paragraph. And I think that's just reflective that, luckily the Cape has not had a huge number of cases.
Yeah.
And no one town, with the exception of, the towns out here on the outer Cape, our numbers have all been pretty low, and let's hope they stay that way.
This is John. Perhaps we should put some type of box on our website that breaks out the COVID-19 statistics for the town of Chatham, and just reflect in that box the cumulative confirmed cases as one number, and then the deaths as another number. And as you get updates, then we change the number on the website, and so it's there for anybody to see if they want.
Yeah, we could certainly consider that. I will tell you, we don't get any information on the deaths by town.
Oh, we don't?
No, the deaths are only reported by the state in cumulative number or by county.
Okay. All right, so that's another question then.
Yeah, so we wouldn't necessarily have easy access to the number of deaths information for Chatham specifically.
Okay. Do we think we're going to get those questions?
You never know.
This is Judy. The death information is difficult because the way, as Bob was saying, the way it's reported through the state, we don't necessarily get notified. So sometimes that information is coming, by the nurses who are doing the follow-up, and it may be a few days before we even know. I mean, certainly if we heard the information, we could put it out there, but.
Well, that's a good question. If because we're a small town and people know each other and talk, if the word was that we learned of a death involving a Chatham resident, would we at that point post that fact on our website alongside the case count, or would we defer on that? Would we just as soon not share that kind of development? What do other members think?
This is Noble. I think that Bob would probably need some kind of an official number, not anything that comes from a resident or from
Right.
hearsay. I mean, it would have to be an official number that comes from the state, I guess.
Right. But
Now, the other thing I was going to say, this is Noble again, on the website, there's the COVID-19 box. If you check that, then you get a list of all the pertinent things relating to the COVID-19 virus and all the health board updates and new guidance and whatnot. And I guess you could do that. You click on COVID-19, and then you would have today's case count or the most recent case count.
I think that would be good. But so is it the board? Bob, do you have a feeling on what your bias would be, or does in terms? I mean, suppose we go 3 weeks from now. Suppose we've had 3 deaths and our case count is 16. I mean, are we going to include that data in our website box or not?
I don't really have an issue with including a case count on the website. I'm a little
total case count.
Huh?
A total case count.
Yeah, total case count. For Chatham, I don't have an issue doing that. I'm a little less optimistic about putting up the death count. I mean, I think at that point it's, and I think somebody mentioned this earlier, Chatham's a small town. Everybody pretty well knows everything. There aren't no secrets around here. I'm not sure what putting that number up really is going to do for us.
All right.
Bob, I have a question. How do you get a total case count for Chatham every day, or just when the number changes?
No, the only if we want to know what the case count specifically for Chatham is, we would get notified through the Maven system, or else Judy or I or both of us would go in and take a look at the system, see if there's been any new updates to it. Part of the issue is, it's as the number of cases increases, statewide, that system's getting, it's slower because somebody has to go in and manually put those in. And if somebody's got a whole that just makes it difficult, to keep that up to date. That's why, I think the state was kind of saying, just put out the county level information because, they put that out and, I think we all recognize probably 5 minutes after they put it out for the day, it's probably out of date. But, they're releasing it every day at the same time. So there's, and that's what I send you guys, the graphs and whatnot of that information. I just started the graphs myself because to me it's easier to track than looking at 20 sheets worth of numbers.
Yeah.
Yeah, this is Noble. Yeah, so I don't know how much work that entails, but I think to me what we would try to do, if it's practical, would be to have a daily case count, because that's what the paper's asking for. I think that's what other towns are doing, and people are sort of getting the information in dribs and drabs. I feel a little funny if I hear a new number from a neighbor, and because I didn't listen to something. So I would think we try to do every day. I don't know the manpower thing. I don't know if the secretary can help. I don't know how that works, but because I think it's moving so fast, that's what people want to know, the daily count. It wouldn't obviously be weekends, I guess.
Yeah, we could certainly look at putting a daily count up on the website. I don't think it would be too difficult. We just kind of pick the same kind.
Forget about deaths right now. Just do the case count.
Yeah. Okay.
All right. I'm fine with that too. Any other board members want to comment on whether they're okay with that policy going forward?
Alan, I'm okay with that.
Okay. Ed, you okay?
I'm on, Ed's okay.
All right. Good. All right. So that's our plan for that. Why don't we move to item 3 on the agenda, which is the discussion.
John,
Go, Judy.
I'm sorry. Before we move on, there was the issue with the Cape Cod Healthcare doing some mapping of cases on Cape Cod, and they wanted to release the number based on zip codes. With us having 4 zip codes in town, I think we were all a little uncomfortable with that. I thought we could talk about it briefly. My thought is perhaps we could allow them to lump all of our cases into one zip code per se. That way we don't have it broken out into South Chatham, North Chatham, West Chatham.
And the beauty of that, if we went that way, is that number would be then equal to the number that we're posting on our websites. It would be, they'd be cross-confirming.
Right.
Yeah, this is Bob. I think we'd have to be very careful doing that. I think we'd have one number or the other. I don't think we'd have both. If Cape Cod Healthcare goes ahead and does what they're proposing, we would probably just set up a link between our website and theirs for that information. Because what I wouldn't want to see is exactly what you were talking about earlier, where we'd have one number on the website and they'd have a different number because one was newer than the other or something like that. The other question I have is, I'm not sure if the Cape Cod Healthcare number is only going to be cases that they would be dealing with, where if somebody was transported, say up to Mass General or something, I'm not sure that they would absolutely show on the healthcare site. So again, and I think it's, how the data is presented and what's included in the data to make sure it's consistent.
Are they asking for town by town approval?
They had originally come out last week at the end of the week and said this is what they were going to do. And a number of towns, including Chatham, kind of said, well, wait a minute, we're not sure we want you to do this. And we said our board is going to talk about it tonight and we'd get back to them.
Yeah, this is Noble. Yeah, I think that we're on safer ground using the state number. I mean, Cape Cod Healthcare is kind of a private entity. It's hard to know what exactly they're going to come up with. I think we should stick with the state number, which would then be the whole town. I think releasing zip codes gets closer to this thing about
Confidentiality.
Narrowing it down to certain people or whatever.
Can we opt out?
And I don't think we know what Cape Cod Healthcare is exactly going to do. So at this point, I would, my own opinion would be to just use the state number
and opt out. And opt out of the healthcare systems plan.
Yeah, I mean that's a private entity. I mean, I guess it's most of the healthcare, but who knows?
Judy, what do you hear from your other health agents around?
I think the similar concerns is that they don't really want things to be that specific.
And you don't want to put it in the hands of someone else. You mean, I think the town would want to have its own number that they're releasing.
Yeah, I'm not sure I understand where they're getting their number. I guess that's something I could look into a little bit further, because I just kind of assumed that their number was going to be our number, but yeah, that might not be right. They may be using a different number. I don't know, just the numbers they have at the hospital or,
Right.
So I can get a little more information on that. That's for sure. Right now, we can just tell them we're not comfortable with it, and till we get more information.
Okay.
And we can proceed with just making public the state number, daily during the week.
Right. There has been
Okay.
some
Then it could start.
discussion
That could start immediately. Then.
There has been some discussion with other agents saying, maybe they could do it by region, like Lower Cape, Mid Cape, Upper Cape, just because we don't have such a huge number, and it's all about mapping for them. They're trying to show the hot spots.
Oh, they're doing a color-coded map.
Right. Exactly.
All right. So then, Judy, the plan would be for you or Bob to notify them that Chatham is not comfortable at this point opting into their program. We need to learn more, and we'll leave it at that.
That's fine if that's what you want. Yep.
But this is Noble. But we would proceed with releasing the state case count daily.
Exactly.
Yeah.
This does not change our decision that we just made.
Right. And I think that would make it easier on everybody, actually.
Sounds good.
Okay, so we have no interest in being included in their plans as originally outlined. Okay.
Correct.
All right, we're good with that then. Let's go down to item 3, which is a discussion about the construction sites in the town of Chatham. I know that Judy had shared with our board members, some rough information that came from another town in Massachusetts. I think it was Northampton. And then that's been superseded by a more recent document that came from the state of Massachusetts, which I think everybody did get by email as an attachment. I hope board members got a chance to go through that. The title of the document is COVID-19 Guidelines and Procedures for All Construction Sites and Workers at All Public Work. And this was a multi-page document, very thorough, I must say, that included a lot of information that I was surprised to see. And have other board members had a chance to kind of go through this and see what the state is doing?
Yeah, I looked through it briefly, I guess. But also, somebody from the Natural Resources sent out to the Chatham Board of Health a Chatham proposal, employee handout, and then the second page is on-the-job procedures. I'm guessing this came from Bob Duncanson, which was comprehensive and looked very good.
Yeah.
They're both very similar.
Yeah, that came from, that's the Northampton, I put that together on our letterhead, but that's basically the Northampton.
Oh, okay.
But that's been superseded, has it not, by the state's document?
Well, the state didn't have a document, I don't think, up to that point.
But they do, I'm looking at it. There is one now.
Yeah, it's Bob. Maybe I can jump in and help clarify this. The state had guidelines for construction sites probably 2.5 weeks ago. The one difficulty that we have with them, and even in the ones that Ed's alluding to, the ones that we just sent around the other day, the problem you run into is it says at all public work.
I'm sorry, say that again?
Yeah, the guidelines refer to public work.
Oh.
So, there's been this whole question of, does it apply to, I've got a contractor working on my house and it's a private job kind of thing. And what Northampton did and what Judy did was to basically take a lot of that information and basically just broaden it so that it's not specific to public jobs, if you will, but it covers any construction in town. So, even if it was a private contractor building a new house or remodeling a house or something like that, theoretically, these same guidelines would now apply. It's a little bit more complicated in that, would it apply to landscapers and those kind of jobs, or is this really just construction related? And then the whole enforcement issue.
Yes.
I had a conversation, or I had an email exchange with town council on this topic, and he said the Board of Health can certainly do something like this, but you'd have to craft it in exceptions, if you will, or exemptions. Because, if somebody has their water heater lets goes and it damages the interior of the house, you want to make sure that they can get that repair. If it needs winds, if a tree branch falls and damages a house, you want to make sure they can get repaired. So, it's great to put this kind of stuff out as kind of advisory and as guidelines. I'm not sure we want to go as far as making it mandatory and have to figure out some way to enforce it, which is another whole issue,
Right.
that would complicate it. That's why, the Northampton one really doesn't have any enforcement to it. It's just, here's some information, here's some best management practices that you should be doing if you're going to do this stuff. Because I will tell you, we've gotten a few calls from people in town saying, they're building a house next door to me and the guys aren't 6 feet apart, and they sit on the tailgate of the truck, 2 or 3 of them together, and have lunch, and they're not doing all the things that they should be doing. And so that's absolutely true. We've seen it. The question is, what do we do? Do we just go out and hand out these flyers with, building permits and whatnot? People are aware. I did talk to the community development department about this. And they said, yeah, we can certainly hand this kind of information out. Problem is, a lot of these jobs are ones that already have their building permits and are already underway. So, how do we, other than just driving around town, and when we see somebody doing something, go up to them and say, here's some information and some guidance for you. I'm not exactly sure how to kind of, make a dent in this issue.
It's a good question. It's a good question. I was assuming that this was a statewide document that would apply to all construction. So that's my miss when I read it. I didn't realize it was limited to the public construction projects. Well, I think the content in the Northampton and then the subsequent Chatham draft is fine, but I think it's too wordy. I think if we wanted to develop a handout, an advisory handout to use here in town, I think it should be redrafted to look more like a poster or a flyer rather than a small print document that I don't think a lot of contractors would even read through personally. What do other people think? I mean, the content of the rebadged one that Judy did is good. I just think it's almost too wordy.
Yeah, this is Noble. Yeah, I kind of like the idea that there's an employee handout. It would have to be real simple that you're supposed to give to the employees that they would read. Just the usual stuff. If you're sick, don't come to work or whatever. And then a separate one that's longer that goes to the contractor. But I agree with John that to try and make it more concise and something that would be more readable, attainable to a contractor. And I guess the beginning of the thing Judy sent out, it says she put in Town of Chatham. It says the following policies and procedures must be implemented. But we would put it out. I mean, I agree with probably putting out more as a guidance, and then we're not because we don't really know how we're going to police it or exactly. But at least it's out there, and then you could say, well, we'll monitor things, and if it looks like there's widespread non-compliance, then you can toughen up what you're doing. That would be, I think, a reasonable way to approach it. But I would be interested in what Judy and Bob think in terms of what's practical for us to actually do here. I think it's a good idea. A lot of these workmen come off Cape. They drive from wherever, New Bedford, Fall River, Plymouth, and they're coming down to work for the day.
Yeah, I agree. I think, to give them something like this 2-page policy, they're probably just going to end up in the trash. But if I could somehow streamline it into more of a pamphlet that could be handed to everybody, and then something like this document for the actual foreman or the company to have, it might be a little bit better. But it is going to be difficult to police. Seeing as we're short-staffed, it's really just me and Bob here. But we got to get the information out there somehow, and so people can at least think about what they should be doing. Yeah,
and you could put it on the website. I mean, you'll probably get calls from people. I don't know, but
I would put it on the website, and I would involve the code department, code officials, with the task of helping to distribute it.
Yes, that would be
when they have. Yep.
Yeah, I think that would be a great point of distribution, is having the building inspector handing it out when he goes on inspections.
Yeah, and I think we could look upon it. The guidance is good. It would be nice. It's fairly strict, but it would be good to do. It's a matter of what we can do right now. But if we make an initial step and sort of think, well, we'll see what happens, and we'll think about tightening up enforcement or what we're doing later if there are more complaints or more non-compliance. I mean, that's a pretty down the middle of the road approach.
I think that makes perfect sense. And if the other board members are okay with this, I would ask that Judy take a crack at reformulating the Northampton document into something that's more user-friendly as a handout, and then share it with us so that we can, read it through and feel good about it and take it from there.
Okay.
Yeah,
Is that
it's,
okay?
Dr. Duncanson, are you sort of, are you agreeing with this or thinking along the same lines, or what are your thoughts?
yeah, no, I think that's fine. What I was gonna say is there is in the state's packet on the last page, there's actually some graphics that, hit on all the major points. We can certainly take a look at that, and I think those graphics are available, pretty easily online right now, because you can pretty well find graphics for just about anything COVID-19 related. So we could see what the state and the CDC and all have for graphics. And maybe, it's just a one-page handout with the graphics on it that goes to all the workers, if you will. And as you said, or Judy said, kind of a little bit more detailed pager that goes to, say, the foreman or the company. But I can, Judy can work on that, and I can help her out with that as well.
Right. And a graphic could be posted on site. That's something that may transmit more information, actually.
Yeah.
Okay. But I like some of the items in the state document that says something like making sure that all your workers are healthy before the start of the day's work. Maybe having at the job site the fact sheet available, either posted in some way. And even one of the things I saw in the state document was if you or a family member is feeling ill, stay home. I hadn't thought about that. I don't know whether we would include that or not, but it's a thought. Okay, why don't we do that? Why don't we request that Judy, with help from Bob, try and transform the most recent document into something that's more visual and more abbreviated, and then we can take it from there. It's a good question, though.
Yeah, no, I agree with that. I think, and put it in terms of guidance, and that sort of puts the enforcement a little bit on hold.
Well, we're running out of time, and Judy needs to clear the deck so that the Board of Selectmen can get on this system at 5. So what I'd like to do is suggest that we postpone the minutes, the approval of the minutes, until our next meeting, and that we consider adjourning. I will ask if there's anybody on this call from the public that wishes to make any comments for the board at this time. Please do so.
Yes, Steve Buckley, I have a comment.
Okay.
I was just wondering, as a matter of using this platform, are the presenters, is it possible, I know it's possible to bring up a document to look at it so that everybody could see, like change the chart, what Dr. Duncanson was referring to a thing. I was just, as a matter of procedure, I was just wondering, is someone capable of pulling up a document so that everybody can see what they're talking about? That's
a good question. I don't know. Right now, we're just on audio only. So in this format that we're using today, it would not be. But if we were in a time frame where everybody on the call was on camera, I don't know, Judy, do you know the technical question, the answer to the question?
Yeah, I mean, if we did this, if everybody was on Microsoft Teams and wasn't calling in from a phone, we could, and I could bring up documents. All the documents that we referred to, as far as the ones that were sent to you in your packet, and then a few more that were emailed regarding the construction site stuff. was all posted on my town government. It is available for people to look at during the meeting. So, but in the future, we may need to put up some documents if we do plans, septic system type stuff, and that's something that we will work on for future meetings.
And
All right.
just a clarification there, Judy may not know this, but you don't, a remote participant does not have to have Microsoft Teams. They can, there is a button that says join on your browser. So if somebody pulls up that link, they don't have to, have an account. They can just join using your web browser, meaning, just the non-joining link. So just clarifying that.
Correct.
Okay.
Yes, and all the
All
board
right.
members could join that way as well. We just haven't quite got there yet.
Yep. Okay. Just want to.
All
And the
right.
other part, one other part. I'm Steve Buckley. I'm on the Economic Development Committee, and of course, earlier in the conversation, and I realize you're running out of time now, but the Economic Development Committee I'm sure, is very interested in the finer points of the short-term rental things, along with other aspects like, any other type of social distancing effect on the summer season. So I'm just
Yeah.
putting it out there that maybe there's be some occasion to use a platform like this to get the word out about the ramifications of this, that, and the other. So thank you.
Okay. Thank you. Time is short. I would like to suggest that we get a motion to adjourn our Board of Health meeting.
Move we adjourn the meeting.
Do I have a second?
Second, Ed Sheehan.
Okay, all in favor of adjourning the meeting?
Aye.
I'll call your name.
Aye.
I'll call your name. Ed, are you aye? I got to do a roll call. Ed?
Ed Sheehan.
Yeah. Are you okay with adjourning the meeting?
Yep.
Dr. Hanson?
Aye.
Dr. Ward?
Yes.
And myself, aye. Okay. So the meeting is adjourned. And stay tuned. We'll update board members as best we can in the near future. Thank you very much, everyone, for coming. Thank you, Bob. Thanks, Judy.